morning, guys. This is Eunice, and man, we had a rainy mess yesterday. A rainy mess. But today, this morning, we just got wind, and it's rather nice outside. I got my little sweater on here. Took Hardy out for his little walk and all that stuff. So today is going to be Shaw Herbal Medicine Herbal Knowledge Day for the Thursday. Okay. Normally we do this on Thursdays when we get busy on Wednesday. So we're going to go ahead and get started. Not going to hold you very long, but we just want to get this information out because so many things are going on and people don't really know a lot about herbs. They don't know how to uh, help themselves to keep themselves well. It also, like most doctors would talk to you about, is preventative, things like that. Let's say, for instance, someone who has insomnia and everything, drinking a nice, warm, hot chamomile tea will help you to sleep better and things like that. Herbal medicine is an alternative medicine and it's helped so many people, and so we want to get the word out. So welcome to Show Herbal Medicine, and my name is Eunice, and I'm here to give you some herbal knowledge. Today we're going to talk about uh, prickly ash bark. And there is two types of prickly ash bark. You got the northern prickly ash bark, and then you got the southern prickly ash bark. So today we're going to talk about the southern prickly ash bark. And the reason we're going to talk about that is because we want to talk to the people who has poor blood circulation and everything. Well, the southern prickly ash bark is really, really great for that. And we do have a lot of people who are wearing those, I can't remember what those stockings are called, but they're used because of the poor circulation. There's a lot of people suffering with joint pain because of poor circulation, inflammations, and things like that. And they're also suffering from poor circulation, not just in the legs, but in the extremities as well, the fingers as well. So we're going to talk about that, so that, we can give you this information so that you can help yourself. Okay, so prickly ash bark is used mainly for poor blood circulation, and it's a common thing, and we have so many people who have this issue. It is also it helps with joint pain, as I was saying, and things like that. It also helps you with the toothache. It also helps you with sores, and it also helps you with ulcers because prickly ash bark has a chemical in there that helps actually to numb. Like when you have a toothache, it helps to numb the tooth and so forth. And some people do use it for that. Also for sores and things. Again, prickly ash bark is used to help the blood circulation. It helps to heal the sores a little bit faster and so forth by having blood circulate to that particular area and so forth. Because when you get a cut or sore or anything like that, it has to have the right ingredients to heal, which means that it has to have the air, the blood circulation, and all those things combined together to heal. Okay, and we do need to keep our blood circulating well throughout our system, because if you don't, then you're gonna have more problems and so forth. The blood has to get through your legs and through your fingers, because it could cause numbness and other problems and things like that. And some people have actually lost limbs due to poor circulation. So we want to address that and so forth. and get you into, these herbs that, may help you with that. So if this here fits any of your symptoms and so far and everything, then you need to seek a herbalist or healthcare provider, and you need to, try to get some of these prickly ash bark, the southern kind, for that poor circulation and so forth and everything. So you want to get that word out for that. Okay, so again, there is a lot of people that have that and so forth. And poor circulation could come from so many other things, other injuries, and even medication that can slow down your blood and so forth to keep your blood from circulating throughout the body and so forth, and things like that. There are just so many reasons for that. And that's one of the reasons, too, that you need to seek a herbalist or healthcare provider, because you may want to, or you do want to know where that is coming from, the poor circulation coming from. And again, most people that do come to a herbalist and things like that, they are, trying to get help. They've already been to the doctor and all that, and they, for one reason or another and so forth, they're not having a whole lot of success and things like that. But, it just all depends and everything. And one of the reasons too is if you are taking traditional medicine and so forth, you want to make sure that this prickly ash bark is not going to have any, I say confrontation, but there's another word for it, that it's not going to interfere, is the point. It's not going to interfere with your traditional medicine that you are taking. So that's, the reason that you need to check and so forth. And do your own research on this here, because again, there are two. And if you do get into the herbal medicine and so forth, you want to make sure you get the right one, because the northern prickly ash bark is has other, you know symptoms that they take care of and so forth. But the southern prickly ash bark is what you want for poor blood circulation in the legs and extremities, fingers, and things like that. You want to keep these things working. Okay, for toothache, it helps with toothache, sores, and also ulcers and so forth. Now, when I say sores and ulcers, these are skin surfaces and so forth. We're not talking about stomach ulcers and all that. We're talking about ulcers on the skin. Um, and also too, it can help with stomach ulcers, because this is a herbal medicine that you consume, that is consumable. Because this is how you would take it for the poor blood circulation and so forth. So it's going to help you, you know, either way, it's going to help you. It's going to help you for the blood to circulate to the sores and to the ulcers and so forth, to help heal it faster. And also, it's going to help blood to circulate to your legs and extremities, the fingers, and so forth, so that you'll be able to use them. Because if you have numbness and so far, you're not going to be able to use your leg or your extremities and so forth for a certain amount of time. So, like I said, this kind of situation with poor circulation causes other problems which you don't want. So, get some help. Talk to your doctor. Talk to a herbalist. Let them to do a medical check to make sure that what you are taking is not going to interfere if you do want to try prickly ash bark and so forth. But it is a great herb from my research and so far. And we do have a couple clients that did use prickly ash bark, and they have not had any other issues with the blood circulations in their legs and so forth. We did have two clients come in with that poor blood circulation. And these are not elderly people that have came in with that and so forth. When you think about poor circulation and so forth, most people mind goes straight to the elderly and so forth. But these two people were not elderly people and so forth with the poor circulation. I don't think poor circulation has a number or age with that and so forth. But anyway, we recommended, because you can't diagnose because we're not doctors, but we recommended that they try prickly ash bark for the poor circulation. And so far, so good. So there you have that. And thank you for joining me today on Short Urban Medicine, Short Urban Knowledge. And we are talking about prickly ash bark, which is the southern prickly ash bark. Mainly, our conversation is about poor circulation for the legs and extremities, fingers, and things like that. So, make an appointment, check it out, see if it'll help you. All right. If this message information can't help you, always pass it on to someone who it may can help. Because this is the reason why we are putting this information out there, is so that it will help someone and everything. And thank you to all the people that are responding to these videos that I'm putting out. I really appreciate you letting me know that you have done this, that you are using that, and this and that, and this is helping you, which is really, really great. And thank you. All right. Bye.